So today we're going to be doing an arthroscopic posterior labral repair, and we have the instruments and tools set out here that we're going to use. Starting off first, we have modular components that's going to let us put our cannulas in place. The cannulas I like to use for this labral repair are these Geminis. They allow us to do soft tissue retracting. This is an 8.25 millimeter cannula. Next are the modular handles on the soft tissue elevator. We have a 15 degree and a 30 degree elevator. We have rounded ones and we have sharper ones that are squared off. I like to use the torpedo for the shaver. And we have the new Mini KingFisher that allows us to grasp tissue, suture, or tapes. Okay, so we have a left shoulder. We're in the lateral position. You can see I've marked out my acromion. We're used to most of these portals are pretty standard for us. We end up having a viewing portal here, anterolateral, that we do most of our viewing from. Starting though, we're going to start posteriorly. Most of us are used to this portal, this posterior portal that's in line with the posterior acromion. For posterior labral repairs, we like going in with a portal that's a little bit more lateral and a little bit more inferior. That's really going to help our angle here of instrumentation. When we're doing an anterior labral repair, we're usually bringing our instruments across so we have a portal that's a lot more medial. But when we're doing a posterior labral repair, coming up a little bit more lateral lets us really come in for our anchor placement in a good orientation. We're in our lateral position. You can see I'm viewing through an anterolateral portal. We have our mid-glenoid portal here coming across from anterior. We're looking down. This is 6 o'clock right here. So I'm looking from superior to inferior, and this is our posterior labral tear here. Viewing from the anterior aspect here gives us this great view, and this is why we prefer to do these cases in the lateral position. We can see the entire glenoid. We can get all the way around inferiorly as well. And so we're going to start with our angled soft tissue elevator. As we introduce it into the joint, we have the sharp part of this facing up so that we do not scrape the glenoid cartilage. We bring it all the way across the joint, and now we have room to safely turn it over. And this is how we avoid causing any iatrogenic damage. But you can see coming across here, we want to get right in the interface between our labrum and the glenoid, and we just want to elevate this tissue. As I'm doing this, I keep my fingers very close to the cannula so I know there's no way I can plunge. We don't want to hold it all the way on the back part of the handle. If we do that, you could suddenly plunge forward when you reach this across and you separate this tissue. But just this kind of gentle motion here, and you can see we can elevate this tissue. I'm getting all this tissue nicely elevated. You can feel that give way as we do that. And again, that's why I hold this very close to the cannula so I can't plunge. But we want to be able to get this view where we have this whole thing, the whole labral complex now lifted up. This is going to allow us to get great bites of this tissue for our repair. And now we're going to come in with the torpedo. You can see the nose here of this allows us to retract the labrum. We can push the labrum back out of the way and prepare the bony edge here for insertion. We can also use a curette for this. There's a lot of different instruments. You can use a rasp, but we want to do something to prepare the glenoid. And so you can see this labral tissue is not vascular. You can stab that with a needle, it won't bleed. So we're gonna get our bleeding from the bone. And then we're just gonna use this to just clean up the edges there. That frayed tissue peripherally is not gonna help with our repair, so we're gonna clean this up. We're gonna come in now with our Mini KingFisher. And as a test to make sure we've done adequate preparation and we can lift this tissue up and make sure we're all the way off the edge of the bone there. And that's what we wanna see before.